Essential tips for new parents. Strategies to prevent positional torticollis in babies. Becoming a parent is a remarkable journey filled with joy, wonder, and sleepless nights. Amid the diaper changes and midnight feedings, one crucial aspect often goes unnoticed: your baby's physical development. As new parents, we strive to provide the best care for our little ones, but sometimes innocent mistakes can inadvertently impact their growth. One such condition that deserves attention is positional torticollis. Let's examine what it is, how it affects babies, and what steps we can take to prevent and address it. Understanding positional torticollis. The journey of parenthood is filled with learning and adjustments, especially during the delicate early stages of a baby's development. While every parent strives to provide the best care for their child, unintentional missteps can sometimes lead to concerns, with one particularly concerning issue being positional torticollis. Positional torticollis, also known as wry neck, is when a baby's neck muscles become tight or stiff, causing their head to tilt to one side and their chin to rotate to the other. These muscles run from the back of the ears to the collarbone, and any imbalance can affect the baby's posture and overall development. This can occur while the baby is still in the womb or develops soon after birth. While it can be unsettling for parents to observe, it's important to understand that positional torticollis is not due to parental mistakes or neglect. Recognizing the signs early and taking preventive measures to ensure your baby's healthy growth is essential. Factors responsible for positional torticollis. As parents, we all want the best for our newborns, right? But here's the thing, there's one crucial routine that many of us overlook. From the get-go, the moment your bundle of joy enters the world, their development becomes your top priority. However, many parents are oblivious to a particular practice until it's too late, only recognizing its significance when issues arise. During those initial months, your baby's head naturally tilts to one side. Why? Well, babies have limited muscle control at birth, especially in their neck muscles. This lack of muscle strength and coordination makes it tricky to keep their head steady and centered above their body for extended periods. Consequently, their head may naturally tilt to one side or the other. Childbirth itself contributes to this phenomenon. The pressure and molding the baby's head undergoes during delivery can temporarily affect its shape and position, making it more prone to tilting in a specific direction. Other factors, such as the baby's position in the womb before birth, can also influence their head's preference, leading to a tendency to tilt in that direction. While this tilting is a normal part of development, continuous favoring of one side can lead to specific conditions like positional plagiocephaly and torticollis. Positional plagiocephaly results in flat spots on the head, affecting appearance and sometimes vision, while positional torticollis involves tight neck muscles impacting balance, posture, and breastfeeding. Various other factors can contribute to the development of positional torticollis, including intrauterine positioning. Limited space in the womb, especially in a breech position, can sometimes lead to the development of positional torticollis. Another factor that causes positional torticollis is muscle imbalances, uneven development, or tightness in the neck muscles, which can cause the head to tilt to one side. Positional torticollis is also associated with birth trauma. In rare cases, difficult deliveries using forceps or vacuum extraction can contribute to the condition. Early signs and symptoms to observe. Parents must be aware of their baby's early signs of positional torticollis. Some key indicators include head tilt. The baby constantly tilts their head to one side, with difficulty turning it freely in the opposite direction. Facial asymmetry. The facial features may appear uneven, with the flattened side being the one the baby tilts towards. Limited neck movement. The baby may have difficulty turning their head fully or resist turning in one direction. Torticollis lump. Sometimes, a small firm lump may be felt on the tightened neck muscle. Addressing concerns. Seeking professional help. If you observe any of these signs in your baby, seeking professional evaluation from a pediatrician or healthcare provider is crucial. Early diagnosis and intervention are crucial for preventing potential complications and ensuring optimal development. The healthcare professional will assess the severity of the condition and recommend the best course of treatment, which may include physical therapy. Early intervention through physical therapy plays a pivotal role in addressing positional torticollis. Physical therapists employ targeted exercises to strengthen and stretch the affected muscles, gradually restoring a baby's ability to move their head freely. This therapeutic approach not only corrects the immediate issue, but also provides essential developmental support for motor skills and overall growth. Gentle stretches and exercises can also help improve neck flexibility and range of motion. Positioning techniques. Special positioning strategies, such as encouraging tummy time on the non-preferred side and adjusting carrying positions, can help promote symmetrical development. Tummy time effectively prevents flat spots by relieving pressure on the back of the head. Gradually introducing it and adjusting difficulty levels to your baby's comfort is essential. Exploring various tummy time positions can make this activity more enjoyable for you and your baby. When your baby is on its tummy, gently tilt it from side to side. They'll turn their head in the opposite direction, strengthening both sides of their neck. Orthotics. In some cases, a specially designed neck brace or helmet might be recommended to help maintain proper head and neck positioning. Lean back. Hold your baby over your chest with their head over one shoulder. Slowly lean back, creating an incline. This encourages them to lift their head and work their neck muscles. Toy tracks. Use their favorite toy and move it from side to side. Holding it at chest level about 10-12 inches away gets the best response. Righty-lefty. Switch arms when carrying your baby. This helps them look around and engage both sides of their neck. It's important to remember that positional torticollis is typically a treatable condition, and with early intervention, most babies experience a full recovery by age 1. Failure to address positional torticollis promptly can lead to a range of complications, including facial asymmetry, delayed motor skills, and potential developmental issues. Strategies to prevent positional torticollis in babies. Recognizing the signs. Positional torticollis often manifests subtly, with infants constantly tilting their heads to one side. Parents may attribute this behavior to preference, unaware of the underlying muscle tightness or weakness contributing to the tilt. Recognizing these signs early on is crucial for prompt intervention and preventing the condition from impacting a child's development. Positional torticollis, characterized by an abnormal neck position due to muscle tightness or weakness, often goes unnoticed in its early stages. New parents may dismiss subtle signs, such as a baby consistently tilting their head to one side or favoring one direction. Ignoring these indicators can delay crucial interventions, worsening the condition and hindering overall development. Parental awareness is paramount in addressing positional torticollis. New parents must educate themselves on the signs of this condition, proactively monitor their baby's head positioning, and seek professional guidance if any concerns arise. By becoming advocates for their child's developmental health, parents can proactively mitigate the impact of positional torticollis. Importance of head movement. Regularly encouraging your baby to turn their head in both directions prevents positional torticollis. In the early months, babies have limited muscle control, making it challenging for them to keep their heads steady and centered. Parents can assist by gently guiding their baby's head movement during playtime, naps, and walks. Creating an environment that prompts head turning, such as strategically positioning toys or themselves, contributes to healthy development. Over-reliance on containers. In the quest for convenience, new parents often resort to the extensive use of baby containers, such as swings, bouncers, and car seats. While these tools may offer temporary respite, excessive reliance on them can impede a baby's natural movement and hinder the development of essential motor skills. Limiting a baby's time in these containers is crucial to fostering unrestricted movement and preventing the onset of positional torticollis. Limited interaction and engagement. Amidst the demands of daily life, new parents may unintentionally limit interactive engagement with their baby. Social development is integral to a child's overall growth, and a lack of face-to-face interaction can impede essential communication and bonding. Striking a balance between daily tasks and dedicated time for meaningful interaction is vital for fostering a child's emotional and social well-being. Strategies to mitigate risks. Parents can adopt various strategies to mitigate the risks associated with positional torticollis, such as alternating the direction of the baby's crib and changing arms during feeding and carrying to encourage balanced muscle development. To further prevent these risks, it's crucial to encourage your baby to turn their head in both directions regularly. This can be challenging in the first weeks of life, but you can assist by gently guiding their head movement during playtime, naps, and walks. Creating an environment that prompts head turning, such as strategically positioning toys or yourself, also helps. Alternating the direction of their crib and changing arms during feeding and carrying encourages balanced muscle development. Incorporating these strategies into your daily routine contributes to your baby's healthy development and well-being. So, if you notice any concerns like flat spots, resistance to head turning, or consistent favoring of one side, don't hesitate to consult a pediatrician promptly. Making these practices a regular part of your routine gives your baby the best start in life. Supporting your baby's development. Beyond mistakes, it's vital to emphasize that every baby develops differently. Instead of dwelling on potential mistakes, parents should focus on providing a supportive and nurturing environment that promotes their child's overall development. This includes regular developmental checkups and attending scheduled appointments with the pediatrician, which helps monitor growth, identify any potential concerns, and receive guidance. Creating a safe and stimulating environment and providing opportunities for exploration, play, and interaction with their surroundings fosters healthy development and building a strong bond. Spending quality time, cuddling, offering responsive care, and talking to your baby all contribute to their emotional and social well-being. Understanding the signs and symptoms of positional torticollis and seeking professional help is essential for ensuring your baby's healthy development. By creating a supportive environment and focusing on their overall well-being, parents can nurture their child's development without feeling burdened by the fear of making mistakes. Every parent is on a unique journey, and seeking information and support is key to navigating the joys and challenges of raising a child. If you have concerns about your baby's development, regardless of the specific issue, seeking professional guidance and support is crucial. Remember, parenting is a learning journey and constant growth, and open communication with healthcare providers empowers you to make informed decisions for your child's well-being.